On February 18th, 2000, I took my last drink of alcohol. I was 17 years old. Last week, I celebrated 20 years of sobriety. Given this significant anniversary, it feels especially timely to be with you here today to talk about prevention needs and young people in our community. It was not easy for me as a queer Colorado Springs kid, a high school dropout, to get sober or even know what that would mean for my life. I feel like I am still learning what that means for me. In fact, I spent a lot of time thinking about it as I'm surrounded by young people who are struggling in my capacity as the executive director of Inside Out Youth Services, our community center for LGBTQ youth, ages 13 to 22. So today, I am here to talk to you about queer youth, integrated prevention, and competent care. LGBTQ youth experience some of the greatest health disparities in our nation and in our region. LGBTQ youth face significant challenges. In 2019, 346 young people who came through the doors at Inside Out Youth Services, representing 48 different schools in our community, half had contemplated suicide, used tobacco, and marijuana. 1 in 3 is currently experiencing homelessness and experienced harassment due to their identity. The Colorado State's Commission report on LGBTQ suicide prevention says that 62.6% of lesbian, gay, or bisexual youth were sad or hopeless every day for at least 2 weeks, compared to 27% of their peers last year. 48.8% had considered suicide in the last year. That's 3 times higher than heterosexual students. It's important to distinguish that these mental health outcomes are not a result of being LGBTQ+. They are a result of discrimination, bias, and harassment these youth experience every day in our community, in our schools, in our health centers, and in our behavioral health institutions. It's important that we review these painful facts in order to understand how we prevent them. We must invest in upstream prevention across multiple behavioral health concerns to effectively support youth. All too often, funding, programming, and organizations operate as experts in one area of prevention. But we cannot approach prevention as a siloed effort. Homelessness, substance abuse use disorder, sexual violence, other forms of violence, discrimination, sexism, and racism all negatively impact LGBTQ youth health outcomes and youth health outcomes. We have to have multi-sectoral approaches, things like comprehensive sexuality education in schools, which is shown to lower students' risk of experiencing sexual violence later in life. And we have to provide access to rapid rehousing and supportive housing, which all should be considered and prioritized as suicide prevention, and violence prevention, and substance use disorder prevention. Prevention efforts must be paired with competent providers so that when LGBTQ youth access services, they are not discriminated against. According to the Trevor Project's 2019 National Survey on LGBTQ youth, 2 in 3 LGBTQ youth reported that someone tried to convince them to change their sexual orientation or gender identity. Providers must get trained and competent in working with this population. A simple way to do this is get serious about using pronouns and preferred names on all intake processes. This in itself has been shown to reduce suicidal behavior 56% when done in additional contexts, like asking for pronouns at school. If we do not take the steps to show LGBTQ youth we care about their health outcomes enough to dismantle the systems that work against them, we will continue to see high rates of suicide, substance use, violence, and discrimination. It's so important that we think about the negative health outcomes such as high rates of suicide risk, violence, substance, and tobacco use that we see in our LGBTQ youth here in our community. The solution to impacting these challenges is to invest in prevention that overlaps connected risks, such as seeing rapid rehousing as not just an issue of homelessness, but as suicide prevention, and seeing comprehensive sexuality education as sexual violence prevention. This alone is not enough. We have to have competent providers who are trained in supporting LGBTQ youth so that accessing behavioral and mental health services isn't another venue where they are experiencing discrimination. I don't spend a lot of time agonizing over the pains of my past. I've had a pretty privileged life at this point. But it doesn't escape me, as someone who struggled with substance use disorder as young as 11 years old in this community, experienced homelessness by age 13, and am a survivor of sexual violence, that we could be preventing the pains of our youth today, in the present, simply by mobilizing our support and affirming who they are. Thank you.